Please start. You are on mute.
Am I audible now?
Yes.
So today we are going to have some discussion on hypothyroidism, as I was told. So should I start? Because there are very few people.
Yeah, there will be people watching on YouTube as well. So yes.
Okay, so hypothyroid is a disease, or a disorder, we can say, which is because of the underactivity of one small organ, part of our body, which is situated in the neck. It's a butterfly-shaped organ, which is called thyroid. So this thyroid is a very, very important organ in our body, one of the important organs in our body, which secretes a hormone called thyroid. Okay. So whenever this organ is underactive, when the activity is less or the hormone is not used properly, it is called hypothyroidism. And when its activity is more, it is overactive, it becomes hyperthyroid. So you must have seen people with big eyes or people with goiter here. So that is the overactivity called hyperthyroidism. So underactivity of hypothyroid is also becoming very, very common, especially in young females over past 20, 30 years, if you can say. And since this hormone is important for our body metabolism, as other hormonal organs like diabetes also, and in other hormone related problems in our body, thyroid also is a hormone which stabilizes our body metabolism, is involved in the energy expenditure of our body, and its underactivity makes body lethargic because energy is not given to the different body parts. So the body becomes underactive, body becomes lethargic, just like in other metabolic disorders. So because it is to deal with metabolism of the body, so this is also, hypothyroidism is also called as the metabolic disorder, or disorder which is linked to your body and mind. Since all these body-mind problems have been on a rise for last 20, 30 years, hence hypothyroid is also a problem which is increasing day by day. Now, it primarily affects females, more in females. And again, the range is, let's say, 12 years. It starts developing and it can go up to 60 years. Past 60 years also, we have seen many ladies having hypothyroid problem. Now, what happens, all of us would know that whenever we have these symptoms which are linked to other metabolic disorders, like when we start gaining weight, when we have facial hair, or when we have water retention in our body, or when we have a period problem. So the girls have been advised to go for certain tests, hormonal imbalance tests, and like diabetes test or the PCOD test. Another test which is very important is the thyroid test, which is they are made to go for the hypothyroid test, whether they have any underactivity of the thyroid. So and it is increasing, and it is becoming it is rising. The incidence is rising, as I said, in young girls. So you must have seen when we get the results of this test, we get T3, T4, TSH, 18 values we get. And on basis of these values, we try to find out whether one person has thyroid or not. Now, if you are having a diagnosis of hypothyroid, it is a problem which will remain there for some time. It is not easily gone. It is not easily curable. There are many, many reasons for this kind of a problem and why this is increasing. Some people have congenital problem like babies who are having less activity of the thyroid gland right from the beginning, which is called as congenital hypothyroidism, which is also increasing these days. I mean, in that what happens is the intellectual capability of the child, growth of the child is stunted. The child is not growing as it should grow, and he or she should grow. And there's a problem in teething, there's a problem in puberty. So this is also, this is a congenital from the birth. Majority of the hypothyroid causes are because of the autoimmune disease. Autoimmune is when our own healthy cells, they start eating the thyroid tissue. So, and the cause is autoimmune. It is still unknown. It is unknown, and it is called as autoimmune. So in that, what happens is that the total thyroid tissue, it is eaten up by healthy cells. So the total amount of thyroid which the thyroid organ should secrete, it is not secreted. So what happens? Thyroid hormone, which is T3, T4, you must have seen, they are the two types of thyroid hormones which are secreted, and under influence of TSH, which is the third level which you have seen in the test, this thyroid stimulating hormone. So that which is this thyroid stimulating hormone, it is secreted by a gland which is in the brain called pituitary. So pituitary organ, it stimulates TSH, and that instigates the thyroid to produce hormones which are used in the metabolism of the body, T3 and T4 hormones. So whenever there is underactivity of this gland, thyroid, T3, T4 are not produced as much. It could be because of the problem, as that autoimmune problem, congenital problem. This could be because of surgery if it has happened in the gland, or this radiation happened in the gland, or under influence some drugs like hypertensive cardiac related drugs, or we have bipolar disease drugs are given, or cancer drugs are given. Under influence of those drugs, the organ also becomes hypoactive, less activity of the thyroid hormone. Or it can also be because it travels in families. If you have a family history of hypothyroid, so you will have your children also prone to becoming hypothyroid. So what happens? The T3, T4 hormone come ho jate hain body mein. So TSH, which is secreted by the pituitary, it increases in the blood because it wants the hormone to be produced more. It tries to stimulate the T3, T4 production by thyroid hormone. So level of TSH, it increases in the blood. So whenever the level of TSH increases in your blood, and this blood test, which is taken in the morning, early morning, empty stomach, the level is increased, that means you are having underactivity of thyroid and you are diagnosed as hypothyroid. So increased level of TSH in the body is an indicator that you have thyroid. Now this kind of problem, which is because of the basic problem with the thyroid gland, that it is underactive. This is called primary cause, primary hypothyroidism, which is because of the problem of the thyroid gland. It is not producing enough hormones for the body. Now there is another problem, which is thyroid may be normal. Many people must have seen thyroid may be normal, but still you have symptoms of hypothyroid. So that means there is some secondary reason. It could be because of the pituitary problem. It could be because of hypothalamus. What happens, as I told you, that thyroid hormones are secreted under influence of a hormone, TSH, thyroid stimulating hormone, which is produced by pituitary. Now that hormone is also under influence of another organ in the brain, which is called hypothalamus. So hypothalamus, it produces thyroid releasing hormone. So thyroid releasing hormone, if it is not produced well, it will not stimulate the pituitary wala hormone, and the pituitary wala hormone also is underactive. It will not produce the proper thyroid hormone. So there are reasons which are secondary to the hypothyroidism, which are called secondary hypothyroidism or central hypothyroidism, which is because of the problem with pituitary and hypothalamus, that means brain problems. So this kind of secondary hypothyroidism is not very, very common. It is less common. Primary reason is thyroid is not functioning properly. So there is another condition, if you've seen there. So in condition when the thyroid is not working properly, TSH levels are high, you will see the symptoms of thyroid coming up in the body. And symptoms, I will tell you what symptoms primarily happens. There are sometimes we have seen the thyroid TSH levels are normal, but still you have symptoms. So in those cases, it is called subclinical level. Subclinical level means you are at risk. Let's say if thyroid ki TSH ka level should be, let's say, about 0.5 to 5 milliunits. That is the range. Now, if you are within this range, you are normal. But if you go beyond this range, let's say you go from 5 to 6 to 7 to 8, you are at risk of getting hypothyroid. You might not be having hypothyroid. Classical hypothyroid happens when it goes beyond 10. 5 to 10 ke beyond chala jaye, then you become hypothyroid. Of course, you need to consult with the doctor for all these details. Just to tell you that because many people may not be having classical thyroid problem, but they will be at risk. And the risk could be because of hypothyroid problem or could be because of the environmental problem, because as I said, this is metabolic disorder. It is psychosomatic disorders. There are other reasons. There could be other reasons of you getting hypothyroid. Could be because you already have diabetes, could be because you are hypertensive, you have PCOD, you have obesity. So you are prone to getting hypothyroid. So those are called as subclinical hypothyroid. So in that case, you might not be given a hormone therapy, but you have to be careful. You have to be screening yourself every now and then. If you start gaining weight, if you start getting period problems, you have to be cautious about it. But once you get it, it is 10 or beyond 10, that means you are having hypothyroid and you have to get a replacement. There's no other solution or treatment for hypothyroid but to get the thyroid hormone replacement, which is must, and you can't avoid it. If you avoid it, you will have many problems which are associated with hypothyroid. You'll get hoarse voice, you'll get heart problems, arrhythmia problems, because energy is not distributed throughout your body to all the organs in your body will slow down. So the symptoms which you will get is that you will become lethargic, you will start gaining weight because body is not metabolizing energy, you will start gaining weight, you will start having sleep apnea, sleep problems you'll have stress, depressions, that is part of every metabolic disorders. So you will start getting period problems, is also part of every metabolic problem. Then you start getting cold intolerance. Jaldi thand lagegi aapko. You'll have dryness of your mouth and tongue. There, you have many other like breathing problems, and you'll have problems with your intellectual mind is not properly working, and so you'll have certain problems which are linked to your memory, certain problems which are linked to your total body expenditure also. Like many other problems are there, which are also somewhat related to other metabolic disorders. So sometimes it becomes confusing whether you have hypothyroid or not. You may be having pure diabetes or pure PCOD, because diabetes has a solution. You have to get anti-diabetic drugs. PCOD, there is no solution. But in hypothyroidism, you have to get replacement. There is no other solution but to get a replacement of the drug, of the hormone in your body. And once you start getting replacement, you become normal and you can do activities which are healthy. So besides the drugs which you have to have, or the hormones which you have to get replaced, it is very important to do nutritional and your lifestyle management, because it is a lifestyle disease. as we already discussed other lifestyle diseases, you have to be careful about. And it is possible that if you are able to manage your lifestyle properly, if you are managed to have a balanced diet properly, you would be able to have the not have the side effects which are related, like obesity, and obesity will give rise to many other problems, like sleep disorders will give rise to many other problems. So you have to be careful about it. So if we are talking about replacement of the hormone will depend upon the stage in which you are, like hypothyroid, whether you are in which stage you are, what are the reasons of hypothyroid, if it is congenital, if it is autoimmune, or if it is because of surgery. So knowing the reasons, your age, your weight and other issues, you are advised a hormone replacement, which has to be monitored for certain time so that it suits you. And then the dose is fixed by the doctor after doing repeated blood tests and all. The dose is fixed for you, which you have to take it for the rest of your life. It is very important. You can't avoid taking hormonal replacement. There have many people who have, from the clinical point of view, who have become subnormal or subclinical from the high levels of hypothyroidism. But that is if they are able to manage their lifestyle and their nutrition well. So managing the nutrition, as I said, there is no direct role of any food that is related to hypothyroid, but only thing is that because it is the important reason is because of it is autoimmune and inflammatory in nature. Because of the inflammation of the thyroid, everything happens. We have to avoid the foods which are inflammatory, like gluten-free. You must have heard about gluten-free diet or gluten-free foods. We need to have more and more in our body. So gluten-free foods are foods which are high in vegetables, which are green vegetables and fiber foods. Fruits are there, all kinds of fruits. You have all kinds of dairy products you can eat, cheese and milk and butter, etc. you can eat. Then you have seeds and nuts you can eat. You have to avoid only whole wheat. You have to avoid barley. You have to avoid rye. So all these three main having gluten element, you have to avoid these. The rest you can eat most of the food. Now, depending upon whether you are overweight or not, if you are overweight, is a vicious cycle. If you are overweight, then you have to avoid all these things also. You have to take a well-balanced diet and maintain your input and output, as we have already discussed. So because besides the diet, because see, this is related to iodine, if I would want to tell you, is because thyroid hormone is produced with the help of a mineral called iodine. And deficiency of iodine, or if the iodine is more in our body, then also you'll have all these thyroid problems. So importance, but now iodine is fortified. You know, many foods, our salt is fortified with iodine, so that is taken care of. But rest of the cruciferous foods, like you have cauliflower, you have broccoli, you have peas, and everything you can eat. But if you have overweight, then you have to be careful about how much you are eating, because you have to lose weight at the same time. There'll be a lot of water retention in your body. Face will be swollen, and hands and feet, they are having a lot of water retention. So you have to take care of, you have to eat less salt. Water you have to take enough, less salt you have to take, so that you don't retain your body fluids more, because body face swelling of the face or hands and feet, that is part of every metabolic disorder that we have discussed. Now, sleep disorder is sleep apnea or less sleep is very common, because that is also linked. If your body is lethargic, you're not able to sleep properly. Hypothyroidism, you have sleep problems, so you have to learn to do smart sleep. So what is smart sleep? Is basically You have to have 8 hours of sleep, which is very important because this is also related to your stress. Even if 8 hours of sleep means 8 hours of proper sleep, not tossing and turning in your bed. So 8 hours of proper sleep is good for any normal person as well as hypothyroid, because here hypothyroid, because of the problem itself, also you are stressed. You are in the depression. This is also another symptom or sign of or the problem linked to hypothyroid. So you have to have proper sleep. You have to fix your sleep time. And whenever you go to sleep, you have to have dark room. You have to have curtains which are thick enough so that the light is not inside, so that you are able to, which are all these factors which induce sleep. Or if you're not, if you still don't sleep, then you can do something which is relaxing. You can maybe 20-30 minutes before you go to sleep, you can take a shower, or you can take some tea, which is, let's say, not the caffeine wala tea, but some herbal tea or some green tea, which will help you to help you in sleeping. Or you can do some reading or listen to music, but in dim light. And you also have to avoid, like nowadays there are pets in every household, most of the households. You have to avoid pets in your bedroom. So uninterrupted 8 hours of sleep is going to help your immune system to rejuvenate, which is very, very important. We have to not let our immune system to go down. So eating healthy food also will help you maintain your immune system. Sleeping well will also help your immune system to be in a healthy zone. So that is why you have to have adequate sleep. Stress tensions is part of everybody's life. That also is, we have to take care of that. Do some activity, as we discussed many times, is something which pleases you, 20-30 minutes of walking, or some music, or some reading, or painting, or something which will help you come out of these stresses. And activity in terms of, you have to be active in the home, like you have to be walking, any movement will count. You have to be active, do your own activity, so that the feel good hormones or feel good chemicals, they are inserted, and they will help you maintain and rejuvenate your immune system. That is something which we have to do, especially in people who are hypothyroid, where the immune system is compromised. So exercises we've already discussed. Mood swings are very common. Mood swings, not like you will be in having a mood problem. So you have to do something about it. You have to live so that you are able to, without being judgmental about it. Let's say we said you have to be, you have to look into the state you are right now. The ability to watch your physical and your emotional states is something which is called as mindful living. So mindful living is something without judging yourself, without being judgmental. You have to see in which situation, mental or physical situation you are. That is something, being mindful about it. So you have to be living mindful, in a mindful state. Exercises we've already discussed. You can begin with light exercises. Because of autoimmune being compromised and your energy levels are also not in a very healthy level, you have to you have to keep in mind that heart is also a muscle ultimately. You don't have to do very strenuous exercises. You have to build your stamina gradually, so that you start with 10 minutes, 15 minutes of some exercises, and gradually you increase your body stamina, and you can go up to 30 minutes of exercises every day or every alternate day, so that your body metabolism does not go down. It remains static, it remains maintained. That is going to help you in the conditions which are associated with hypothyroidism, like stress and being lethargic and weight gain and many other problems associated with it. And also you have to take care of any other comorbid situation, which also is also part of hypothyroidism, happens with hypothyroidism, like diabetes. You have to be careful about it. Any other metabolic disorder which is there, which you have to be careful about it. A holistic approach of, as we are taking care of metabolic disorders, since this is also a metabolic disorders, related to your mind and body, you have to be careful about your eating and about your lifestyle management. And the replacement of hormone is must. You can't, you cannot avoid it, which is very important. People say like, mera hormone has come down, so I can do on my own and I will cut down my own. You should not do it. You should never do it, never without consultation of a doctor. Do not alter your medicine, increase or decrease your medicine. Your medicines, your hormones definitely will get reduced as you lose your weight, as you stabilize your body functions, your hormone levels definitely will go down, but it has to be done only under consultation of a doctor. Don't do it yourself. So this is something which precautions we have to keep in mind, especially in young girls, because they are prone to stresses and strains and depressions of life. They have to understand that it is not curable. You have to live with it, and you have to be careful about it. And 100%, if you are taking care of your other surroundings and other your lifestyle and your eating pattern and your stress levels, you will be able to avoid these side effects, which are not very good as far as the hypothyroid is concerned. So this is what little bit I wanted to share with you about the problem which is growing these days in young girls. Yes.
Thank you, Dr. Shobha. You covered it so well, so many aspects, even though we had some idea, but we did not know like this. So if anyone has any question, please feel free to ask.
Most,
Thank you very much.
yeah. See, most people know about these things, but about especially hypothyroid. And I have also seen in my working career is that since it is more, always said it is more common in females, but males also can get hypothyroid problem, because it can also happen. You get predisposed to it if you have diabetes, as I said, if you have other heart problems, if you are being treated for something else, you can become in a subclinical state. You have to be careful about it. And once you get it, and since it travels in families, I've seen it traveling through male partners also. So like male members of the family also. So males can also get it. They should also be careful about it. Check your weight, check your lifestyle, take care of your environment. You would definitely avoid all these metabolic disorders and symptoms. Yeah.
Awesome. Anyone wants to ask any question? And did you mention that thyroid can be replaced? So is it by drugs or is it by surgery?
Thyroid hormone
Okay.
produced. It
Okay.
has to be replaced. There's no other treatment for thyroid but to get replacement of the thyroid hormone which is deficient. जो नहीं produce हो रहा है, it has to be replaced. And depending upon your age and your statistics and your condition, the how much it has to be taken, that has to be deducted, determined by the doctor only. The doctor's consultation is very important, and we don't have to avoid it. And it is at birth also. If somebody is like in pregnancy, I would tell you is another reason is that in pregnant women also sometimes hypothyroid is detected, which could be subclinical hypothyroid. Maybe they are obese or they have a family history, so they get prone to diabetes and hypothyroid. So they can have it, their baby can have it. Of course, it is curable. Like you are curable means it can be treated, you can get replacement, and maybe after pregnancy you become normal also. So gestational hypothyroidism is also very common, which can be taken care of with the replacement of the hormones which are deficient.
I have a question from Malaysia, doctor.
Yes.
Sorry, I joined a little late. being Sunday, I just told Shabana, caught up with a lot of things, but no excuse. Thank you so much. This is a topic that is close to everyone's heart, especially if we are therapists and we deal with people. But I don't know if you have already discussed this and I missed it. But in my mind, I'd like to know what are the long-term effects if you are on hormone therapy, and how would that affect lifestyle?
Uh, any kind of hormone therapy, including hypothyroid, you will have side effects. Like you will have weight gain, you will have a puffiness in your body because of water retention, and you can have your throat will be hoarse, uh, voice will be hoarse. And but if you are able to take care of weight gain, as I said, is you definitely, there is no, like in PCOD, we could avoid taking hormone, but here we cannot, because this is to do with your body metabolism. Otherwise, your body metabolism will slow down, and you will be leading a lethargic life. So you cannot avoid taking hormones. Hormones we have to take, but if you are careful about after taking hormones also, with hormones also, you have to address your other issues like weight gain, yeah, stress problems, depression problems, which are part of hypothyroid. Even if with hormones, you have to be careful about, try and relax yourself with something else, and something which is helping you deal with the stress and depressions. Um, and weight gain problems, try to balance out your input and output, be a little more active, take care of your sleep, as we discussed. You cannot avoid the problems, and these are the major problems which are side effects of a hypothyroid person. And but doesn't mean that we have to avoid taking hormones, as we can do in PCOD. We can avoid taking hormones, but here we have to have replacement. Otherwise, we will land up into heart problems primarily, because it will cause atrial fibrillation. It can cause osteomalacia, like your bones will become thinned out. So you have to have replacement. And the moment you get to know about it, you have to start replacement there and then. If it is, even if it is at plus 60 age, you have to have replacement for this.
Another question, doctor, something that is a bit sensitive, and I know if you are in the medical practice, you would not be conditioned to actually look into it. I have 7 doctors in my family, so I know. Uh, is there anything in terms of an alternative that you could take, um, not to totally replace your hormones, but to ameliorate the side effects? India comes with a tradition of centuries of usage of natural products from Ayurveda to elsewhere. It may not be in the medical books in terms of the justification and rationalization to take them, because it's always research based with all your data. But if we can, in inverted commas, put that aside, and look at maybe food or maybe lifestyle that would ameliorate these effects long term, is it advisable? Is it something we can even think about, or we should like totally cut it off? One of my sister-in-law is a professor of psychiatry in Australia now. She's retired and she's moved and practiced. And I'm a therapist, I'm a hypnotherapist, I do wellness as well to some degree. One of my students wanted to commit suicide, and the minute I called her, she said, "No, get him into a hospital, and he needs this and da 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 da."
Yeah.
He wouldn't do anything, but I used my own judgment, and I helped him out. He didn't commit suicide. I used NLP. I used nutrition. I used a lot of things, and today He is lecturing in Singapore, and he's done very well. And finally, I found that, I can talk about it. He was being sodomized by his brother from the age of 7. So if I just went to a psychiatrist, he said, no, suicide. Oh, immediately get him into the psychiatric ward. And I know so many people I am now healing. They were all locked up in psychiatric wards, and their parents are all doctors.
Yes.
So I humbly apologize for this question. But, I'd like to maybe tickle some of the thoughts of traditional doctors, from that point of view. So it's just a cheeky question on my side.
No, it may be a tricky or cheeky question for somebody who is into clinical practice totally. I have been in practice for last 30 years, which is positive healing, positive wellness, preventive aspect of healing. The traditional doctors, they just look into the curative side. Diseases happen, they will give you medicines, it will kill your whatever tissues or something, and it is symptomatic treatment. My way of dealing with any problem is finding out the root cause, so that we are able to address the basic issue, why this happened. And if it is possible to eradicate or to do something about it, we will definitely do through alternative ways, as you suggested. Lifestyle management and diets and everything, and hypnotism also sometimes. There are many such things which can be adjuvant, but they cannot be specifically in hypothyroid. We cannot replace them. They're not replacement for any hormone. Like you people have gone for Ayurvedic treatments or homeopathic treatments. We should not do that. We can do alternative ways of healing and wellness, but replacement of hormone is must here. So replacement of hormone, which is lacking in your body, along with the alternative ways of healing your mind and your body is equally important. As you rightly said, the conventional doctors do not address this. They are not interested. They are just interested in the curative part of it, the symptomatic treatment. So I am doing this practice, or I am involved into the preventive aspect, so that the disease does not happen. That's how I started the obesity management program. Curing obesity is okay, but why it happens, what is the reason? And it is important to know that then only you can address and attack a situation. And since our environment is such for past 20, 30 years, is that we cannot change it. We have to learn to be in this environment, learn to modify our eating culture and our lifestyles, counseling or take consultation, share our thoughts with the people, because depression, stresses are equally part of this hypothyroid problems, because you will feel that why me, why it has happened to me. But that is your basic genetic nature, why you are getting, why your sibling is not getting it. But you have to understand and you have to acknowledge it. This is very important, that you have to acknowledge you have this disease or any other disease, psychosomatic disease. You have to learn to be in this disease and use all alternative methods, as you have suggested, lifestyle management, diet management, and etc. Counseling and healing, and they also will help. Definitely, they help in taking care of the side effects. Like if you are just taking medicines and you're not careful about your weight, you will get obese. You will get obese and you will have side effects. You will get prone to diabetes. You will get prone to many other problems. So these are the alternative ways of healing are equally important in this nowadays, and also past 20, 30 years. That's what I have been doing, practicing the holistic way of healing besides the curative part of, or that means giving just medicines to the person. They are equally important, and you are right about it.
Thank you, doctor. That is, I think we are on the same page. Very hard to find anybody like you.
Yeah.
I think we are very blessed to listen to you. And it's wonderful. I wish we had more people from Malaysia. Um, every other day I hear horror stories. A friend of mine went to work in Australia for like 2 months. She came back. Yesterday, she told me she was in hospital.
Yeah.
She had rheumatoid arthritis out of the blue. I helped her with all her weight management problems, a lot of counseling, and she became a very good friend of mine. She's a quantity surveyor, young girl. But yesterday she told me the doctors gave her a painkiller for 1 month, and I wouldn't even take that painkiller for more than a week. And I screamed. I was in the middle of the road. I was getting out of my car when I was talking to her. And I was horrified. I said, you are in the top hospital. They charge you. If it's India, it'll be crores. And they give you this painkiller for a month. And you know what she told me? They busted my kidneys. I sat and I cried. I just sat down and I cried and I cried. And I said, Hema, how can they do that to you? And I'm not a medical doctor. I have a PhD in education. I've spent 30 years learning, reading, nutrition, helping hypnotherapy, and whatever you call it. But I'm not a medical doctor. But that I know, you cannot do that. Even my husband had 3 surgeries. I told them, you just give them that for 1 week, top it up with antacids and a lot of food. But this is what's happening in the world, doctor. That's the truth of it. And if we go up to any doctor, they say, no, this is rubbish. It's voodoo. It's the witch doctors do that. It doesn't work. Well, and I'm going to be 76, and I'm really proud that this sort of knowledge has come to me. And today I told Shabana, I've been away in Germany. I came back. And in 3 weeks, I leave for South America and Antarctica. I'm, collecting a lot of information. And I was very, very busy, but I'm glad I listened to you. And I think we need people like you on board. So bless you and thank you so much, Doctor.
Thank you. I appreciate it. Thank you. This was the primary reason of my leaving my clinical practice and coming into alternate ways of healing, because I was working in the medical institute AIMS, dealing with the problems, and we were all there to take care of the problems, like somebody has diarrhea, somebody has this and that. So, but nobody was interested to find out the reasons why have the diarrhea, or why they have rotavirus, or why they have why this is problem. That means they are not looking into the sanitation, the problem which is coming from where they are coming. So you have these all cases which are referred to AIMS from all over the, in fact, Delhi as well as outside Delhi, but without finding out why and from which region. I was involved into a research actually, from where and what are the conditions in which these people are living. So do we have to take care of those conditions? Do we have to alter those conditions, or alter the lifestyle, or alter the way they are eating, alter the way they are living? This is something which doesn't come under the purview of the doctor's calendar. Actually, they are into curative. So prevention is something which is happening now. You see happening in a big way, and we've tried our best to address this issue, which was obesity, which was the mother of all these psychosomatic problems. And we have been successful. I had made 50 centers across India just to educate. And it used to take me, I'm talking about in 90s, it used to take me 2 hours to explain a person why he should be healthy. So he used to come with the problem, I have obesity, I have overweight, just give me a pill or give me some elixir so that I become normal weight overnight. So it used to take me hours to explain to one person, we have to find out why you are obese. It cannot be one single reason that sometimes people say we are overeating and then we are obese. But it could be many other reasons why somebody is obese. It could be because of the mental food which is going inside. We discussed about this in our last Zoom meeting. So addressing the root cause, addressing the basic problems, addressing the environment is something which is going to help us cure a disease or cure a disorder and cure something which, and help it not to become a disease. A disorder becoming a disease can be helped if and when it is at the level of the disorder. So that was my motive, and that was my mission, is to make everybody conscious and do a deliberate effort to remain healthy. This was my motto when I started this work which I am doing right now, to make every individual be conscious and make a deliberate effort to remain healthy. Without a deliberate and conscious effort, you cannot be healthy. There is no elixir, there is no magic pill or magic potion which will make you healthy overnight and will make you healthy for the rest of your life. You have to be conscious. You have to be working on it continuously every day, and you have to be on it. You have to give it priority. That is what my aim is, to make people give a priority to themselves, to their own health, to consider that they are also important besides their lifestyle, besides the other environment and their families, etc. If they take care of themselves first, understand why they are having a problem and address it, they will be able to win the race. That's what my effort is, and it will always remain like that.
Morning, Dr. Kaul. I joined late, Shobhaji. I wanted to know what foods to avoid for hypothyroidism.
So we've already discussed this. Basically, because it is an autoimmune disease primarily, you have to avoid things which will become which are like gluten free. Like you have to have whole wheat kam khana hai aapne, you have to have barley kam khaiye, rye kam khaiye. But rest of the millets and rice you can eat. You can eat vegetables, you can eat fruits, any kind of fruits and vegetables, high fiber foods. You can eat pulses, you can eat many things you can eat, provided you don't have weight issues, because it is a vicious cycle, as we discussed. You gain weight as a side effect. You have to be careful about it. Weight, you have to maintain your weight as well. So everything you can eat in a proper proportion, and which is a well-balanced diet, so that you don't gain also weight. And
Is ragi okay?
sorry?
Ragi.
Yeah. All kinds of millets.
Atta is not good.
Whole wheat it has got barley, it has got gluten in it. Whole wheat avoid kariye. Rest you can eat
Barley and rye. Okay.
rye and whole wheat. You should avoid it.
Also, it says don't have cabbage, don't have broccoli, don't have.
So it is only if you have autoimmune problem. If you have autoimmune problem, but the reason of your hypothyroid can be because of many reasons. If it is because of the autoimmune problem, that means you have immune problem, then you should avoid all these which you mentioned.
How do you know if it's autoimmune or if it's a lifestyle disease? Like they say, it's a lifestyle disease.
No, you can get it checked. No? If you have Hashimoto's, if you have problem, because you tend to find out if it is a primary, if it is a secondary, if it is a subclinical level of hypothyroid, you have to get yourself tested. And if you see that your TSH levels are normal, but you have symptoms, then you have to see if this is related to lifestyle or not. And but we have also discussed that if your TSH levels are normal, you still have symptoms, you still can have hypothyroid. So doctor can consult you, tell you whether you actually have hypothyroid or you are subclinical. That means you are at risk. You have to avoid all these things so that you don't get weight and you are having proper sleep, etc. These are things which you have to first get yourself tested, because one blood test.
I have it, but I was told it's due to stress.
It cannot be primarily only because of stress. Stress could be one inducing factor. There has to be something to do with beyond the stress, because stress, if you have stress and if you have any kind of stress, can give you any kind of metabolic disorder. But if you specifically have hypothyroid and if your blood levels are beyond 5 to 10 milliunits, then you have to have thyroid and you have to have a replacement of medicine. The rest, lifestyle management is part of any, and diet management is part of any problem. If you have stress, only stress is the reason, then you don't have to avoid cruciferous foods. Zarurut nahi hai. But if you have Hashimoto's autoimmune, then you have to look into the iodine content in your body and the sources of iodine, sources of selenium, like that. So a doctor definitely would analyze it, but only stress giving you hypothyroid, it would be subclinical. It would not be ideal. It has to be some other reasons.
I don't think, I mean, I don't know any doctor who, they diagnose it like that. They just see your TSH and T3 and T4 and then they tell you how much to
As
eat.
we already discussed, sometimes TSH levels are normal in certain cases, and still you have symptoms of hypothyroid. So you have to symptomatically treat them. So you can have primary, you can have secondary reasons of hypothyroid. And yes, definitely doctors would see just TSH levels are normal. So they will say, okay, you're not hypothyroid. If you have symptoms of hypothyroid, you are at risk factor. If you are in that not being in the healthy category of TSH, which is between 4 and 10 or 5 and 10, you are at risk. You may not have classical hypothyroid problem with hypothyroid gland, but if you have symptoms, you could have problem with your pituitary, you can have problems with your hypothalamus, which are also the secondary reasons, secondary hypothyroidism. So in that case also, you have to be given medicine or not, that the doctor will tell you. But definitely in all conditions, lifestyle has to be managed. Your diet has to be managed. Proper balanced diet has to be taken, proper sleep and proper stress management.
Can it be cured? Is there a way of curing it?
No.
Getting rid of the whatever dose you have?
Yeah, the dose can be reduced. It can come back to
Dose is reduced.
Yeah, you
But
can come.
I mean, there was some kind of kriyas which help you get rid of thyroid. Is that a possibility?
So again, depending upon the reason why you're getting thyroid, is it because of the gland which is underactive? Because of stress, as you said, it can be, in that case, it can come back. You can reverse it also. It has happened. You can become in a subclinical level where it is not showing in the blood or it is not showing in your symptoms. But if it is to do with your autoimmune system, if you have that problem, if you have anti-inflammatory problem, if you have surgical problem, if it is because of the radiation, it is because of some drugs which you have been taking, then you cannot avoid taking medicines. But if it is just linked to your lifestyle, as you said, because it is a lifestyle disorder, it is a metabolic disorder, then your figures will come back, your blood levels will come back, and you can be in a subclinical level, but you will always be at risk. You cannot avoid. You always have to be careful about it, and at risk of. And if you are able to control your weight, you can be in the subclinical level. But once you have it, your dose also will be based on your weight, your age, your other problems associated with it. The dose will go up and down based on that. If you lose weight, your dose will go down. Definitely. And if your doctor says you are in that condition where the dose is 0, it can happen. You are come in the subclinical level. That is another way how you are monitoring it, that the doctor will tell you about it. Yes.
Okay, thank you.
Yes, one question. Thank you, Shobhaji. Very nice session about this hormones and all that. I just want to know the lifestyle. Today's lifestyle, we are using Botox on hair and nanoplasty and all that smoothing, and without knowing any side effects over that. Is there any effect on our hormones?
Yeah, definitely. Because if, let's say you talked about Botox, Botox is for wrinkles and etc. Or maybe, and so you have to see Botox is something which does affect your nervous system. It relaxes your nerves. If you have wrinkles, you inject Botox here. It how does it affect? It affects your nervous system. It relaxes the nerves. The wrinkles are gone. So something which does affect your nervous system, definitely will have a side effect. It has a side effect. It can become, if you take it in a substantial dose, it can become cancerous also. So we have to do certain things which are not affecting our body physiology or body organs. Like instead of relaxing your wrinkles with Botox, you can use fillers, which are equally, they will also, filler will remove your wrinkles, but it will not affect your nervous system. It will not affect your nerves. It will not relax. It will just fill the underlying crevices where the wrinkles are happening. So you can fill the gap. That is not going to be having any, so anything which is not affecting your system, you should always read it and always do those things which will not affect your any part of the body or your body chemistry. So because ultimately they will have a long-term effect. All of them will have a long-term effect.
I mean, these days girls are using this parlors and without knowing anything about the hormones and all that. Every parlor, yeah.
Definitely. As I said, there are substitutes. The Botox substitute is filler. You can do it. There's no problem. Rest of the because this hormone problem is becoming very, very common in beauty parlors. Definitely, Botox is one which is recommended. बाकी ऐसे दवाई खाने को नहीं, they don't give any medicines to take. That's a problem. But everything to be done with your body or your skin, you have to read it carefully. Or the somebody who's the doctor who's treating you, you have to be, he's answerable to.
They are not doctors, they are just a beauty parlors. And,
Don't do such things. Right now you can get information from anywhere, all sources. हाथ पे मिल जाता है आपको, आपका phone पे, you can get all information. Find out and read through it. And if you feel it is good for you, do consult. Botox is something which I don't want anybody to interfere with their body physiology. वो नहीं करिए. आप filler, मैंने आपको, I gave you a alternative is do fillers.
they do for long time, 5-6 hours nanoplasty and smoothing and all that processes. Parlors there, people at the long time it may have any effect, no?
Yeah, it's all of them. If you read through them, they will always say long-term effects are there. Long-term effects would be in, even if we take normal medicines also, paracetamol also, long-term effects are there also, because ultimately it's an artificial thing that goes inside our, fiddles with our body chemistry. Anything artificial which is done for a longer time would, if it is not interfering, if it is not invasive, if it is not interfering with blood chemistry. So anything done on a long term is not good. So why do it? Do in natural way. If you can, you have many natural ways to do whatever alternative you want to do in your life. So and definitely study about it and do it. Don't do indiscriminate. Let's say many people that we've already discussed it about PCOD. Many girls are advised pills khalo, hormonal pills khalo. It's not required. It's not required because hormones, if you take it after the third cycle, you will start getting all symptoms. सब problem आपको आ जाएगा, weight gain हो जाएगा, side effects आ जाएंगे उसके. So it is better whenever, if you require hormone replacement, specifically in PCOD, you require hormone replacement if you have to plan a family. अगर आपको बच्चा करने की जरूरत है, then you can be under care of a doctor, take hormone pills, regulate your menstrual cycle, and then conceive. But otherwise, if you have PCOD, you don't have to take any replacement. But in hypothyroid, you cannot avoid taking medicine. You have to take medicine because this is to do with your body metabolism, with your body energy expenditure in your body. and it may lead to many problems, heart problems, osteoporosis, etc., etc. If you don't replace this. So ISCA replacement is must. You have to replace it with hormones. Yeah, you can't avoid.
Thank you. Thank you. Thank you.
Thank you so much, Shobhaji. You covered it so well, so many different aspects. So, yeah. So I don't, does anyone has any more question? We are already 9, so maybe we can wrap it for today. Yeah. So once again, thank you so much, Shobhaji, and thank you everyone. And looking forward to see you tomorrow. Thank you.
Thank you, everyone. Thank you, doctor. Thank you so much.
Thank you. Thank you.